Today, we're going to take a deep dive into a procedure that's really been the foundation of open heart surgery for decades, the full sternotomy. We're going to break down what it is, why it's still considered the gold standard, and walk through the entire process step by step. So let's get into it. Okay, so let's start with a really basic but super important question. When someone needs a major, complex open heart surgery, how do the surgeons actually get to the heart? How do they create a safe, clear, and stable path to work on the most vital organ in our bodies? Well, the answer to that question for a huge number of cases is a procedure called a full sternotomy. So let's start right there. What exactly is it, and why has it become the standard approach in cardiac surgery? At its heart, no pun intended, a sternotomy is all about creating a perfect surgical entryway. A surgeon makes a vertical cut right down the sternum, your breastbone, and then carefully divides the bone itself. This allows them to open the chest up and get a direct, totally unobstructed view of the heart and all the major blood vessels. This is the go-to technique for some of the most critical heart operations out there. We're talking coronary artery bypasses, complicated valve replacements, fixing congenital heart defects, the kind of surgeries where millimeters truly matter, and you have to be prepared for anything. Having that wide open view isn't just nice to have, it's absolutely essential for success. So that brings up a really good question. In this day and age with all the talk of minimally invasive techniques and robotic surgery, why do surgeons still so often choose this more traditional approach?
Well, the decision really boils down to three key things. First, the absolute need for wide, direct access. No small keyholes, no cameras, just a clear, direct line of sight. Second, it's chosen when an operation is really complex, involving work on several different parts of the heart at once. And third, sometimes a patient's own condition just makes this traditional, controlled method the safest possible way to go.
And this really gets to the core of it all. Look, less invasive options are out there, and they're great for certain cases, but the full sternotomy is still the gold standard for a reason. When the number one priority is a stable, predictable, and completely open surgical field, this is often the safest and most reliable choice a surgeon can make.
Let me take just a few seconds to say that, if you'd like to support my project, you can offer me a symbolic coffee on Ko-Fi. You'll find the link below in the description. You can also check out my book, where I've gathered many experiences and useful tips. Every gesture means a lot to me and truly helps me keep this channel and the whole project going. And if you haven't done it yet, I invite you to subscribe to the channel, turn on the notification bell, and visit my website or blog for more content. Thank you from the bottom of my heart.
All right, now for the main event of our explainer, the operation itself. We're going to walk through the key phases of the procedure so you can really understand how this controlled and incredibly precise process unfolds. It all kicks off with a vertical incision right down the middle of the chest. And just to give you a sense of scale, this cut is usually about 20 to 25 centimeters long, so it runs pretty much the whole length of the sternum. So how does this all come together? Well, it follows 5 very precise steps. It all begins, of course, with general anesthesia, making sure the patient is completely asleep and safe. Then comes that vertical incision we just talked about. The third and really pivotal step is dividing the sternum itself. This is done super carefully with a special surgical saw. Once it's divided, a tool called a retractor is used to gently open up the chest, creating that stable window to the heart. And then, after all the delicate work inside is finished, the final step is closure. The two halves of the sternum are brought back together and secured with strong, permanent metal wires, and the healing process begins. And it's so important to remember this setting for all of this. This whole procedure happens in a sterile operating room with an expert team of surgeons, anesthesiologists, and nurses watching every single vital sign, every second. It ensures the highest possible level of patient safety from the first incision to the last stitch. Now, like any major medical procedure, a sternotomy has some clear trade-offs. It's not all one-sided. So let's take a balanced look at the pros and the cons. The advantages are pretty obvious. Surgeons get incredible access and visibility, which is a massive safety net if any complications pop up. Plus, it's a technique that's been perfected over decades. On the flip side, the disadvantages are mostly about the recovery. You're looking at a more visible scar, a longer healing time, and just a bigger initial physical hit to the body. Ultimately, the decision always comes down to weighing that need for surgical perfection against the realities of what comes after. And speaking of recovery, that's where we're headed next, because what happens after the surgery is every bit as important as the operation itself. So what does recovery actually look like? It tends to follow a pretty predictable timeline. It usually starts with about 7 to 10 days in the hospital for that initial care and monitoring. The next 2 months are really crucial for the sternum bone to heal, so that means no heavy lifting, no driving, no major exertion. But by that 2 to 3 month mark, most people can start easing back into their normal lives, getting back to work, and even some light exercise. When you boil it all down, a successful recovery really comes down to 3 things: having patience with your body as it heals, doing respiratory physiotherapy to keep your lungs healthy, and committing to that gradual, gentle movement to build your strength back up over time. So let's bring this all home. What's the final word on what a full sternotomy really represents in medicine today? If there's one thing to take away from all this, it's this. A full sternotomy is a safe, highly standardized, and honestly, routine procedure. This is performed every single day in specialized hospitals all over the world by expert surgical teams who have absolutely mastered this technique. And I want to end on this really powerful idea. While the surgery and the recovery are obviously a big deal, they aren't the end of the story. In fact, they represent the very beginning of a new, healthier chapter in someone's life.